Welcome to our comprehensive guide on formulating research questions in medical research. Whether you're a student, a clinician, or a seasoned researcher, understanding how to craft a clear and focused research question is the foundation of any successful study. In this video, we'll walk you through the essentials, starting from the basics and moving toward advanced strategies. Let's begin by exploring why research questions are so crucial in the medical field and how they guide the entire research process, from study design to data analysis. Well-formulated research question serves as the backbone of any medical study. It helps define the scope, objectives, and direction of your research. Without a clear question, studies can become unfocused, leading to wasted resources and ambiguous results. In medical research, where patient outcomes and scientific progress are at stake, clarity is essential. By the end of the scene, you'll understand how a strong research question can streamline your study and ensure meaningful, actionable findings. Medical research questions can be broadly categorized into descriptive, analytical, and experimental types. Descriptive questions seek to characterize phenomena, such as the prevalence of a disease. Analytical questions explore relationships between variables, like risk factors and outcomes. Experimental questions test interventions or treatments. Knowing which type fits your study is the first step in crafting a question that's both relevant and answerable. Let's look at examples of each to clarify these distinctions. Descriptive research questions focus on describing characteristics or functions. For example, a researcher might ask, what is the average age of onset for diabetes in adults? These questions are foundational in epidemiology and public health, providing baseline data that can inform further studies. They don't seek to explain causes or test interventions, but rather to paint a clear picture of the current state of affairs. Understanding this type helps you gather essential background information for more complex research. Analytical research questions delve into relationships and associations. For instance, is there a link between smoking and lung cancer in adults? These questions often use observational data to explore potential causes or risk factors. Analytical questions are crucial for identifying patterns and generating hypotheses that can later be tested experimentally. They require careful consideration of variables and confounding factors to ensure valid conclusion. Experimental research questions are designed to test the effects of interventions. For example, does a new drug reduce blood pressure more effectively than the standard treatment? These questions are typically addressed through randomized controlled trials or other experimental designs. They are the gold standard for establishing causality in medical research. Crafting a clear experimental question ensures your study is focused and your results are interpretable. One of the most widely used tools for formulating research questions in medicine is the PICO framework. PICO stands for Patient Population Intervention Comparison and Outcome. This structure helps researchers create focused, answerable questions, especially for clinical studies. By clearly defining each element, you can ensure your research question is specific and relevant. Let's break down each component of PICO to see how it guides question development. First element of PICO is the patient or population. This defines who your study is about. Are you focusing on adults with hypertension, children with asthma, or elderly patients in nursing homes? Being specific about your population helps narrow the scope of your research and ensures your findings are applicable to the right group. Always consider demographic details like age, gender, and health status when defining this element. The I in PICO stands for intervention. This is what you're testing or introducing in your study. It could be a new medication, a surgical procedure, a lifestyle change, or even an educational program. Clearly defining the intervention is crucial for designing your study and interpreting results. Make sure your intervention is feasible and ethically appropriate for your chosen population. C in PICO stands for comparison. This element identifies what you're comparing your intervention against. It could be a placebo, the current standard of care, or no intervention at all. Having a clear comparison group is essential for interpreting the effectiveness of your intervention. It helps isolate the impact of the intervention and strengthens the validity of your findings. The O in PICO stands for outcome. This is what you're measuring to determine the effect of your intervention. Outcomes can be clinical, such as reduced symptoms or improved survival, or they can be patient-reported, like quality of life. Clearly defining your outcome ensures your study remains focused and your results are meaningful. Choose outcomes that are measurable, relevant, and important to your population. Let's apply the PICO framework to a real-world example. Suppose you want to study whether a new drug lowers blood pressure better than the current standard. Your patient is adults with hypertension, the intervention is the new drug, the comparison is the standard drug, and the outcome is blood pressure reduction. This clear structure helps you design your study and communicate your research question effectively. Good research question is clear, focused, and feasible. It should be specific enough to guide your study but broad enough to be interesting and relevant. Avoid vague or overly complex questions, as they can lead to confusion and poor study design. Make sure your question is answerable with the resources and time you have available. These characteristics are essential for producing high-quality medical research. SMART criteria can help you refine your research question. SMART stands for specific, measurable, achievable, relevant, and time-bound. By applying these criteria, you ensure your question is practical and researchable. For example, instead of asking, does exercise help health? You might ask, does 30 minutes of daily walking reduce blood pressure in adults over 50 within 6 months? This approach leads to more actionable and meaningful research. Being specific in your research question helps avoid ambiguity. Specify the population, intervention, and outcome as clearly as possible. For instance, rather than asking, does medication help? Specify which medication for which condition and what outcome you're measuring. This level of detail makes your study easier to design and your results easier to interpret. Measurable research question allows you to collect and analyze data effectively. Define outcomes in terms that can be quantified, such as blood pressure readings, cholesterol levels, or patient satisfaction scores. Measurable questions make it easier to track progress and draw meaningful conclusions from your study. Your research question should be achievable given your resources, time, and expertise. Consider the availability of participants, funding, and equipment. Avoid questions that are too ambitious or require data that's difficult to obtain. Feasible questions lead to successful studies and reliable results. A relevant research question addresses a real need in medical practice or public health. It should have the potential to improve patient care, inform policy, or advance scientific knowledge. Consider the impact your findings could have on clinical guidelines or health outcomes. Relevant questions attract interest and support from the medical community. Time-bound research question specifies the timeframe for measuring outcomes. For example, within 6 months or over a 2-year period. This helps you plan your study and ensures your results are timely and relevant. Time-bound questions also make it easier to manage resources and set clear expectations for your research team. In formulating research questions, avoid being too broad or too narrow. Overly broad questions can be unmanageable, while overly narrow ones may lack significance. Also, steer clear of questions that are unanswerable or not based on existing evidence. Being aware of these pitfalls helps you craft questions that are both meaningful and practical. Developing a strong research question is often an iterative process. Start with a broad idea, then refine it based on literature review, expert input, and feasibility considerations. Don't hesitate to revise your question as you gather more information. This process ensures your final question is well-informed and researchable. Thorough literature review is essential for formulating a relevant and novel research question. By examining existing studies, you can identify gaps in knowledge, avoid duplication, and build on previous work. This step helps ensure your question contributes something new to the field and is grounded in current evidence. Seeking input from experts in your field can help refine your research question. Experts can provide insights into feasibility, relevance, and potential challenges. Their feedback can help you avoid common mistakes and ensure your question is aligned with current priorities in medical research. Involving patients and the public in research question development can enhance the relevance and impact of your study. Their perspectives can highlight important issues that may be overlooked by researchers. Engaging stakeholders early ensures your research addresses real-world needs and increases the likelihood of meaningful outcomes. Ethics play a critical role in formulating research questions. Ensure your question respects patient rights, privacy, and well-being. Avoid questions that could cause harm or are not in the best interest of participants. Ethical considerations should guide every step of your research, from question development to study design and implementation. Be aware of regulatory requirements when developing your research question. Institutional review boards, IRBs, and ethics committees may have specific guidelines for research involving human subjects. Make sure your question and study design comply with all relevant regulations to ensure approval and protect participants. Before finalizing your research question, assess its feasibility. Consider the availability of data, resources, and participants. Evaluate whether you can realistically answer the question within your constraints. Feasibility assessment helps prevent wasted effort and increases the likelihood of a successful study. Conducting a pilot study can help test the feasibility of your research question and study design. Pilot studies allow you to identify potential problems, refine your methods, and gather preliminary data. This step can save time and resources in the long run and increase the chances of a successful main study. When formulating your research question, consider the priorities of funding agencies. Aligning your question with current funding trends can increase your chances of securing support. Review funding calls and strategic plans from major agencies to ensure your research is timely and relevant. Collaborating with researchers from other disciplines can enrich your research question. Different perspectives can help you identify novel approaches and address complex problems. Interdisciplinary collaboration is especially valuable in medical research, where issues often span multiple fields. Consider the translational impact of your research question. Will your findings lead to new treatments, inform clinical guidelines, or improve patient outcomes? Questions with clear translational potential are more likely to attract support and make a real difference in medical practice. Striking a balance between novelty and feasibility is key. While innovative questions are exciting, they must also be answerable with available resources. Assess the risks and benefits of pursuing novel ideas and ensure your study remains practical and achievable. Use clear and precise language when formulating your research question. Avoid jargon, ambiguous terms, or unnecessary complexity. Well-worded questions are easier to understand, communicate, and implement, leading to better study outcomes. It's important to distinguish between a research question and a hypothesis. A research question is an open-ended inquiry, while a hypothesis is a specific, testable prediction. For example, your question might be, does exercise reduce blood pressure? And your hypothesis could be, 30 minutes of daily walking lowers blood pressure in adults. Understanding this distinction helps you design your study appropriately. Research questions can be quantitative, focusing on measurable outcomes, or qualitative, exploring experiences and perceptions. Quantitative questions might ask, how much does a drug lower cholesterol? While qualitative questions could explore, how do patients feel about a new treatment? Both types are valuable in medical research depending on your objectives. Some studies use mixed methods combining quantitative and qualitative approaches. For example, you might measure the effectiveness of a treatment and also explore patient satisfaction. Mixed methods questions provide a more comprehensive understanding of complex medical issues. Medical research is constantly evolving. Be prepared to adapt your research question as new evidence emerges. Staying flexible ensures your study remains relevant and up to date, increasing its impact and value. Document your research question clearly in your study protocol and all related materials. This ensures consistency throughout your research process and helps communicate your objectives to collaborators, funders, and reviewers. Effective communication of your research question is key to gaining support and collaboration. Present your question clearly in proposals, presentations, and publications. Tailor your language to your audience, whether they are clinicians, researchers, or the public. Regularly review and revise your research question as your study progresses. New data, feedback, or challenges may require adjustments. Ongoing review ensures your research remains focused and responsive to emerging issues. Let's look at some examples of well-formulated research questions in medical research. For instance, does a low-sodium diet reduce blood pressure in adults with hypertension over 6 months? Or what are the barriers to medication adherence among elderly patients? These examples demonstrate clarity, specificity, and relevance. It's also helpful to examine weak research questions. For example, is diet good for health? Is too vague and lacks specificity. By identifying weaknesses in poorly formulated questions, you can avoid common mistakes and strengthen your own research. Practice is key to mastering research question formulation. Try developing questions for different scenarios such as clinical trials, observational studies, or qualitative research. Review and refine your questions using the frameworks and criteria we've discussed. Over time, you'll become more confident and effective in crafting strong research questions. There are many resources available to help you improve your skills in formulating research questions. Consider textbooks, online courses, workshops, and mentorship programs. Engaging with these resources can deepen your understanding and keep you updated on best practices in medical research. Summary: formulating a strong research question is the cornerstone of successful medical research. By following structured frameworks, applying key criteria, and seeking feedback, you can develop questions that are clear, relevant, and impactful. Continue practicing and refining your skills, and you'll be well equipped to contribute valuable knowledge to the medical field. Thank you for joining us on this journey.